Hi there, it's Dion Lim in the ABC 7 News studios, and we bring to you now a special virtual discussion, 3 mayors and a doctor answering your most pressing questions about coronavirus and going straight to the source for your answers. So joining me live right now on Zoom is Dr. Bob Wachter, chair of the Department of Medicine at UCSF. Along with him, as you see there, mayors of San Jose, Sam Liccardo, Oakland Mayor Libby Schaaf, also San Francisco Mayor London Breed. We thank you all so much for taking the time out of your busy schedules to be with us. We have 30 minutes, so let's jump right in to Dr. Wachter. Something that we have heard time and time again over the past couple weeks is the term peak. What exactly does peak mean? And is it just me, or can it be a little misleading when it comes to giving the general public a sense of false hope on when things can reopen, perhaps sooner than they should?
Well, first of all, thank you for having me on. It's a privilege to be on with these wonderful leaders who really, I think, saved many, many lives in the Bay Area. The peak is a peak. Think of a mountain, and we have risen the impact of COVID in terms of numbers of the area, or will be there fairly soon. You are not done when you're at the peak. You're at the peak, meaning that you have to descend down the peak to get to a level of new cases that is minimal in an area before you begin to think about entering the next stage and opening up. So there's a risk that people will say, we're at the peak, it's all good. It's not all good. It's actually at its worst. But it does mean that we can begin seeing a way toward the next stage, which is certainly several weeks away.
All right, you mentioned several weeks away. The Trump administration, of course, has been talking about their eagerness to reopen the country as soon as possible. And I'd like to invite any of the mayors to jump in on this next question. Speaking of the peak, what about a timeline? Is it fair to use a timeline of when we may see things start to reopen and business to get back to usual again?
I'll be happy to jump in. First, I should give credit where credit is due, and that is really with the county public health leaders. I know that Mayor London Breed does run a county. I don't, but I really want to thank the folks who have stepped up to be able to get us out there early to shut things down, save a lot of lives. I would point out that, there is not a lot of clarity about timelines right now. I'm on the phone every morning with our county leaders, and they're doing the best they can to try to ascertain what's happening in a very fluid, dynamic environment right now. I think what is within our control, though, are the things we can do to make things safer as we reopen the economy. That is, for example, ramping up testing dramatically, ramping up contact tracing, and getting teams in place that can do the tracing so that people who are identified as being COVID positive can be isolated and quarantined. Those are the things that I think we need to do to support a reopening of an economy and get people back to work. And obviously, it's not going to be with the flip of a switch. It's going to take time, and it's going to be staged. And we're going to really have to continue with a lot of social distancing practices in the meantime.
All of those measures certainly played a big role in California being at the forefront, helping flatten the curve compared to much of the country. But in order to keep this trend going, let's get to London Breed on this. Mayor Breed, California as a whole has been so ahead of the curve. You have been praised for your efforts. But let's look ahead to events for the summer. We have the Pride Parade, which was just canceled, but we are looking at outside lands, big festival season outside with Hardly Strictly. Do you see us pulling the plug entirely and canceling these events? What is holding us back from just saying, let's reschedule for next year? Or what are some of the factors that need to be weighed before making a decision like that?
Well, first of all, I just want to make it clear the Pride Committee decided to cancel the Pride Parade. I think that was a wise decision. We know that there are a lot of events, a lot of activities that are planned, but this is a fluid situation. We know also that we don't know what the future holds. And I do think that there are going to be a number of large-scale events that potentially will eventually get canceled as a result of the situation that we're in. because as we all know, I'm no doctor, but I do know enough to listen to the professionals and the people who are involved in helping us as mayors make these kinds of decisions, that we rely on public health experts in order to determine what's the best course of action. It's really hard to say whether or not some large-scale event will get canceled sometime in August. But at the same time, we also know that we're going to be living in a new normal. Even after we're out of this situation, we're going to have to implement certain policies that somehow take into consideration social distancing, take into consideration events
Mayor
or
Breed,
restaurants or other activities that we're involved in.
The signal is a little bit pixelated and we couldn't hear you. We'll revisit this question in just a moment, but let's also talk about the efforts going on in the East Bay, because this is for Mayor Schaaf. Early on, we saw your response to the pandemic, and from what we have seen most recently, in fact, the 74 miles of roads being closed down so pedestrians can be part of this Slow Streets initiative. My question is, have we seen a positive effect on slowing the virus because of this initiative? And then also, we do know that OPD has had its concerns about how this may attract sideshows. Your response?
So we are always going to follow health advice, and our entire intention in starting our Slow Streets program, which while we have 74 miles of roads identified, we started with just a little over 4 of those miles. And this weekend, we're going to probably move to another 11. We're rolling this out slowly so that we can test what people believe could be benefits and could be potential shortfalls. And certainly we always take the concerns of our police department seriously. Reckless driving in Oakland is real, and we do not want to give anyone a false sense of security just because they have a slow street. I can say that the initial response has been fantastic. The entire intention is to follow the health advice and to allow people the ability to social distance. Before, we were seeing people very uncomfortable passing each other on the sidewalks. We were seeing our parks overcrowded. And so this is part of our new normal. And I want to commend the governor, who really has, I think, exemplified good leadership as far as the way that he talks about reopening the economy and going back to our, former way of life. That happened for very long, and these are the types of to against this deadly virus: social distancing.
Mayor Schaaf, we apologize for a little bit of the audio issues we're experiencing. This is our new normal, trying to hold these town halls via Zoom, but we appreciate your response. Going back to what you said about social distancing, before we get to you, Mayor Liccardo, back to Mayor Breed and the social distancing comments that you made about going forward for this summer season and really making those tough decisions and playing it day by day as to what to do, whether to cancel or to postpone. Can you elaborate a little bit more?
Well, I think that, for example, before we did a complete shelter in place in this region, we were already making announcements limiting large-scale events. We went from limiting events to no more than 1,000 person to down to 500 to 50. We did this, again, based on the recommendations of our public health experts. So I think we are going to rely on that in order to make decisions. And I believe that people are open to the adjustment as long as we communicate the truth of why we need to do what we need to do. And I think that we don't have an answer. This is like many of us have ever experienced in our lifetimes before. And ultimately, our goal is to protect public health. So what that means is people have to be flexible with the decisions that we are going to need to make in order to protect them and in order to protect other people. So I think what's going to go into the decision, number one, does this compromise or protect public health? Like, that's going to be at the center of every decision we make before we make it as it relates to any large scale event.
And when it comes to individuals, we are monitoring our Facebook, our Twitter, our Instagram, and we're listening to our viewers who are writing in real time. And this is for Dr. Wachter. Alex wants to know, when can everyone get tested, symptoms or not?
Well, the question implies, and correctly, that we have come to learn that a fair number of people that have been infected with are asymptomatic. We didn't know that a few months ago, and now it's become clear that maybe as much as 30 to 50% of the people are asymptomatic. The idea of testing everybody all the time is not going to be doable. So we're going to have to come up with a thoughtful strategy that tests people. Clearly, everyone that has symptoms is going to need to be tested. We're going to have to then find out who they've been come in close contact with, test those people. And we're also going to have to begin doing some strategic testing of asymptomatic people. It's not realistic to think about testing everybody all the time, but we're going to have to be clever about this and say, let's test certain populations, see whether we're getting an early indication that the virus might be breaking out in ways that we wouldn't have captured in other ways. At UCSF, for example, we are now testing all patients going in for surgery. And starting next week, we're going to test all patients coming in the hospital, whether they have symptoms or not. For the last 2 days, and I think in large part based on the actions that our political leaders took, the virus has gone down sufficiently that for the last 2 days, we've done 200 tests at UCSF. Not a single one has been positive. And so we are going to be doing some asymptomatic testing just to see whether there's an outbreak. My analogy here is of wildfires, that we are going to get to the stage in the next few weeks, maybe a month, where we have put out the wildfire, but we're going to have to figure out how to look for embers and then stomp on them and make sure they don't spread. And because we now know that some of those embers are in asymptomatic populations, we're going to be very clever and very strategic about trying to figure out where they are before they begin spreading.
I really like that analogy, very easy to digest. Before we get to our mayors once again, another viewer has written in to ask, this is from Melody, when will we know when the schools can resume? And perhaps, Dr. Wachter, you can weigh in on this because you mentioned certain groups being tested first. And of course, if we're talking about schools, these are oftentimes very small children.
Well, I'm happy to be here with them, have these really hard decisions to make. I can just opine about the health issues. The next stage is going to be more complicated than the current stage. The current stage was brutally hard and yet incredibly straightforward. It was stay at home. It was social distancing. Ask was clean your hands, sort of done. Next, it's time to begin opening this, but not that. It's okay to have a small group, maybe at a restaurant if people can spread themselves apart, but not in a baseball stadium or at a concert. And I think schools sort of live in that orbit where it's incredibly important that we get our kids back to school, not only for the kids' sake, but for the parents' sake. What we would have to figure out a strategy to keep the kids apart. That might mean that schools happen in different groups. There's Group A in the morning and Group B in the afternoon. We're going to have to figure out how to do some testing. The good news about kids is kids are very unlikely to get sick. And so when you weigh the risk to a population, the kids are at relatively low likelihood of getting bad outcomes. On the other hand, kids are every bit as capable as anyone else of getting the virus and then spreading it to their teachers, to their home. And so all of that has to be collected and thought through as we make that decision. And it's going to be one of the hard decisions for the public health leaders and the mayors to make.
Well, this is a good segue here because you mentioned keeping kids out. And I want to ask Mayor Liccardo this. You know, when it comes to disaster response, we're talking about large groups of people. What comes to mind is the Coyote Creek flooding several years ago and taking those 14,000 people who had to be evacuated, putting them somewhere, caring for them. You know, what does emergency planning look like going forward? Because it's not as if people can congregate in large groups any longer. Perhaps it's like these schools, maybe they need to start segregating in some way. What would you say to that?
Deanna, you're right. The standard FEMA model is when you have a desire, you open up the high school gym and you put everybody in there and make sure they're well fed and cared for. Doesn't work, obviously, in this pandemic. And so I know that each of our cities has been working furiously to get hundreds of people out of shelters, to thin out those shelters, and then get them also out of the encampments. Many homeless, obviously, are living in conditions that make them very susceptible to the contagion, and trying to get them into motel rooms. We're also taking a step in San Jose to see if we can find some rice with some of the governors made some non-congregate shelters, that is tilt up prefabricated dorm rooms that we can build very quickly on a few sites that will both serve COVID positive individuals today and obviously homeless individuals well into the future. Those are the kinds of things that we're pushing very hard on right now. And I know both Mayor Schaaf and Breed are also working hard on those ideas.
Yeah, and Mayor Schaaf, I believe Oakland had the 2 first hotels available to the homeless population. You know, before we get to you again, Mayor Breed, speaking of the homeless, we recently had the instance where more than 100 homeless people had come down with coronavirus at one of the city's homeless shelters. Moving forward, does this exacerbate perhaps the need, the urgency to move the homeless at a quicker pace?
So moving the homeless into hotel rooms continues to be a challenge. In the age of social distancing, we are expecting to increase our capacity considerably, where we have people who have to be in close contact with folks who aren't always in compliance. They're not necessarily wearing masks when we're asked them to. They're not necessarily following orders that we put into place to keep them safe and to keep the staff at these shelters and at these hotels safe as well. The problems that existed before this pandemic with, sadly, so many of our homeless population around mental health and substance use disorder, those don't just go away because of the pandemic. In fact, it's worse because our social workers, our shelter workers, they are having a really hard time with helping to get their patients and the clients of these shelters in some cases, you know, to follow some of the most basic orders that we're implementing. And on top of that, we are trying to aggressively expand our capacity with disaster service workers, people who work for the city but may work for Park and Rec, the library, or any other department. We have to bring them in, socially distance them, train them, and get them to take on these shifts at these hotels so that we control who goes in and out of the hotel. We're controlling what's happening in the elevator. We're struggling with our challenges of getting one person at a time to use the elevator and not to crowd in on the elevator, to not to go into each other's rooms, and some of the other issues that we face. So people may think that it's easy to say, let's have these thousands of rooms, let's put everyone in a room. But the challenges that existed before this pandemic are even more challenging because the people we're expecting to put their lives on the line and work in these conditions, we have to also protect them too. Not to mention the 3 meals a day, the cleaning of the facility, the laundry and the social services, the detox and the medications. I mean, it goes on and on and on. And the fact that we've been able to put over 750 homeless people into hotel rooms has been incredible. And I want to thank those people who are showing up for work every single day. I mean, even the logistics of moving a client out of a shelter into a hotel room is a whole nother thing when you talk about the need for that driver, the social worker, and the client to be socially distanced from one another when trying to move from one location to another in a van or a car. So it's a lot more complicated than what people are trying to say. We are working hard at it, and I'm appreciative of the dedicated city staff, those who have stepped up. And sadly, we've had some challenges with getting some people to step up when we made those calls. We've had some employees walk out of the shelters and other places where they work because of their concern for their own safety, because everyone can be impacted by this.
All I can say to that is I'm glad you have to deal with the logistics, not myself. It is a multifaceted challenge to have.
But it doesn't mean that we are not working hard. Mayor Liccardo and Mayor Schaaf and the work we're doing to get these hotel rooms and to get the people that we need to staff them and to make sure we're getting our unhoused residents into a protective environment. We're working hard every single day to do that for the people of our cities.
You know, you mentioned logistics, and I have this question for Mayor Schaaf. When it comes to enforcement, that can be such a challenge. There are multifacets to that as well. You know, over the weekend, we heard the story coming out of Santa Cruz where there were a number of people who were fined $1,000 for going to buy alcohol for themselves. Let's talk about compliance and how you enforce social distancing, how you enforce certain rules. What is happening where you are? And do you even think that fining people at this time when the economy is struggling and many people are having financial issues of their own, is that the answer?
You know, I really appreciate how Mayor Breed just laid out how heroic our public servants are in this moment. And that certainly applies to our first responders, our firefighters and paramedics, EMTs, and our police officers. And so they are working under such stressful conditions. And obviously, our community members are full of anxiety because we have unprecedented levels of unemployment. And so, frankly, we have taken the policy direction at this time, and it could change, but so far this has worked, that the last thing people need right now is a fine. We really have been working on education and warning, really building a sense that we are all in this together and that the best enforcement is by the people around you, by your own peers. And we know from data, you know, people have tracked cell phone movement and things like that, that the Bay Area actually has one of the highest levels of compliance with the stay-at-home order. So this is working. We are having to make some very tactical exceptions when we are going to actually use the hammer of enforcement. And I will say in Oakland, we are the way that we have
Okay, our apologies to Mayor Schaaf. It looks like your picture has frozen. We will circle back once again a little bit later on. But until then, she brings up a great point about the anxiety that many people are feeling in our
What's
communities.
going on? I just might.
Oh, it looks like we have some technical issues that we're working through, but we will forge ahead. You know, some of those anxieties that people are feeling when it comes to their employment status, when it comes to their families and the education of their children, something that we have heard time and time again from our viewers has to do with transportation. And if I can, I'd like to still pose this question to Mayor Liccardo on the line, because you're actually joining us after a VTA meeting, so this is very appropriate. This question coming from Facebook: has there been any discussion on how protocol will work for the public going back and using transport once these restrictions are lifted? What is your response?
Well, I think all of us are operating transit systems to cities, so we'll continue doing that. What we have been spending a lot of resources on, and really big kudos and thanks to the frontline transit operators and those involved in the maintenance who are out there doing it every day amid the risks. But we're spending a lot of money on cleaning. We're really trying to make sure every single passenger car is completely clean, and we're doing it multiple times a day. And I think we're going to keep doing it for quite a while, both to ensure it is safe and to give the public the confidence that it can be safe. We're going to continue to need public transit, and we're going to need it even more as families struggle more and more financially. So we cannot assume somehow or another we'll just shift to a world of single passenger cars. Ain't going to work.
And Dr. Wachter, shifting gears a little bit, another question coming in from our viewers, and something that I have my own curiosities about is this term of herd immunity and getting back to the quote-unquote normal. We've heard Governor Newsom talking about this in the past, and we also have heard from other medical experts who say that they have reservations about it. Tell us what herd immunity is, and is it truly something that can be implemented or something that we should count on in getting coronavirus under control?
It's mostly not relevant to our, unfortunately. So the idea of herd immunity is that obviously if 100% of a population was immune, either because they all had an infection and the infection led you to be immune, or they all had a 100% effective vaccine, that obviously would eradicate the infection. Turns out that for most viral illnesses, you don't need 100%. You can get by with a lower percent. For coronavirus, that number is estimated to be about 70%, meaning if 70% of us had been infected, had antibodies to it, the antibodies were 100% effective in blocking the infection, that would probably be enough to get the infection to die off. There would be a number of contacts you would have, therefore propagate the spread. The problem is, it's actually not a problem, it's a good thing. The political actions, the actions by the people of the Bay Area, the actions by the California corporate leaders have led to a fairly low rate of infection in the Bay Area, no higher than 1%. So that's terrific news, but it means that the other 99% of us, assuming those 1% are now immune, and that's not 100% sure, but assuming they're immune, the other 99% of us are as susceptible as we were 2 months ago to getting the infection. To get us to 70%, which would be herd immunity, United States would be stuck with trying to tamp down the virus to very low levels until such time that we have an effective vaccine. And we're hoping that happens within a year, year and a half. But herd immunity is not going to be the way we get out of this predicament.
All right, I know we only have a couple minutes left, so I do want to get to this very important question. And we start with Mayor Breed. Chinatown in San Francisco, considered one of the most hardest hit neighborhoods, something that I've been covering in the news for the past few weeks. They have a double whammy here because not only are they losing the tourism dollars, but they're also dealing with hate being a virus. We heard Dr. Wachter talking about the virus's spread, but this virus of hate is also spreading at an astronomical rate. Can we talk about, I know you've condemned the xenophobia and the discrimination along with our governor, but what other measures are being put into place when it comes to not only Asian community, but also all minority communities that are facing some of these issues, especially small business owners?
Well, I will say that early on, that was definitely a real issue. And in fact, Chinatown was probably one of the most hardest hit communities economically. And we put into place a grant program for our small businesses to provide some level of relief, even though we knew that this was going to potentially be a real problem for businesses all over the city. But it really hit our Chinese serving businesses and owners a lot harder than probably anyone else, along with the xenophobia, the racial slurs, with kids in particular, and some of the hateful things that were said. Kids and other things. And so Carmen Chu, our assessor recorder, she and I we did a press conference. We tried to get the word out and work with folks from various communities to try and put out a message of inclusiveness, but also to make it clear that the virus doesn't discriminate against anyone. It doesn't matter what race you are. And that has clearly been demonstrated as even some of the first cases that occurred in San Francisco. We can't necessarily share And so I think that whole xenophobia thing that once existed has shifted considerably. And now everyone is trying to figure out a way in which how we kind of come together in light of what we know is a real challenge. I mean, clearly, it doesn't matter what race you are, and we definitely have a lot more work to do to get to a better place, but that has not played into the equation in more recent weeks, because as you can see, this can impact anyone at any given time.
All right, I think we are just about out of time. Once again, so many thanks to you all.
I just want to bring up contact tracing.
Let me ask, do we have time for that?
Dr. Watcher, you may be able to talk a little bit more about UCSF and what they're doing around identifying people who are infected and being able to contact not just their family members, but others who may have been in contact with them. That is really going to be an incredible tool to get us back to a better place. Of course, more testing is needed for that purpose, but to identify all of the folks that those people have come in contact with is what we were actually able to do in our shelter, and why we identified so many people that were impacted by the virus. I think, partnering with our Department of Public Health, UCSF, and our goal is to work with the mayors and others throughout the region so that we can really start to expand this work. Because I know Mayor Shaft is very much aware of this and interested in seeing us start to move in that direction.
Not much to add to that. It's absolutely critical. It's in this next phase. We have to find people who have the virus, find out who they contacted, and test those people and tamp this down at a manageable level. And we have been proud at UCSF to participate with the mayor and the Department of Public Health to develop a partnership, train a whole lot of people to go and do this, including some of the city librarians. And so we feel like a contribution. It's absolutely crucial to getting us.
All right, it looks like we were running out of time, but real quickly, some parting last words perhaps from Mayor Liccardo and Mayor Sheff. Do you have anything else that you'd like to contribute to our discussion today?
Incredible cooperation and selflessness within our community as people are stepping up in so many ways. Within days of the time when we launched our Silicon Valley Strong initiative, we had more than 2,700 volunteers step up to say, we want to help and deliver food to seniors or to families in need. We had more than $20 million in contributions. People are really showing their true character. And I think that is so critically important for us in this moment of peril, when I think we're showing ourselves and I think the rest of the country what kind of community we truly are.
And real quickly, Mayor Schaaf, you as well.
Oh, I love that, Sam. And I agree that this is a moment where the generosity and compassion of our communities is really showing bright. I also want to challenge us that there are some parts of going back to business as usual that we may want to re-examine, that this is a moment of reflection for all about impacts on our environment, the incredible disparities in health outcomes by race, and the inequity and injustice in that. So I hope that we also take this moment to think about how we want to come back, not just when we come back.
That time of reflection. Many thanks to our 3 mayors and a doctor for this special virtual presentation. We'll have much more for you on ABC 7 News at 4, 5, and 6 this evening.
Great. Thank you, Deanne.
Thank you.
All right, be well.
Do you want to say anything final?
Oh, here we go. Okay, we're no longer live.